amazing people, welcome back to my channel. Hazel Bulubisi here. If you're new, make sure to hit the subscribe button, and if you're a regular, welcome back. So this week we're going to be talking about diabetes, as it is Diabetes Awareness Month, and Diabetes Day is on November 14th to be exact. So we're going to start by defining diabetes, which is an endocrinological disease where our body has a problem of moving the sugar from our blood and into the cells. And this is where you see the person has a high level of sugar in their blood. So there are different types of diabetes, and we'll start with diabetes type 1. Diabetes type 1 is a disease where you have a genetic abnormality that causes a loss of beta cells. Beta cells are a type of cells that are found in your pancreas that produce insulin. So if you have a loss of beta cells, it means you're not able to produce any insulin, meaning that the sugar in your blood will be high, because insulin is a hormone that is used to control the levels of sugar in your blood. So it's used to reduce the sugar levels. So if you have this genetic abnormality, it means you have no insulin, meaning your sugar levels are high and your body is not able to control the amount of sugar, and this affects you negatively. So in these patients, usually they have to be treated with insulin, exogenous insulin, because they don't have any insulin in their body, so they always have to inject themselves with insulin right before a meal. We also have type 2 diabetes, where the patient is able to produce insulin, but the insulin is not taken up by the cells. This is known as insulin resistance. In the beginning, the patient has normal glucose levels in their blood, and the body continues producing more and more insulin, as it usually does in a normal person. But with time, as the insulin resistance continues, we see that there'll be high levels of insulin in the blood, meaning the beta cells in the pancreas think that there's a lot of insulin, so the body doesn't need to produce more. Hence, they become atrophied, they shrink and produce less insulin. So as time goes by, the patient starts having low levels of insulin in their blood, and hence high levels of glucose, and that's how they get type 2 diabetes. Some risk factors of insulin resistance are obesity, lack of exercise, and hypertension. And usually the treatment for type 2 diabetes patients is giving them anti-diabetic medication, but also at the same time they are encouraged to lose weight, to exercise, and to change their diet so as to start eating healthily. This is done so that they're able to improve their health and they're able to also control the disease. In some patients where they do not respond to anti-diabetic medication, we'll see that onto their medication will be an addition of insulin so as to help the disease. To distinguish the two, usually type 1 diabetes, the treatment is only insulin. So you're given exogenous insulin and you always have to take it. But in type 2 diabetes, it is not necessarily needed to administer the patient with insulin, but only if anti-diabetic medication is not working, that's when you give them. Then another type of diabetes is gestational diabetes, which is mostly seen in pregnant women in their third trimester. And this is seen that the patient the pregnant woman has high glucose levels. It is not understood as to why this happens, but people think it's because during pregnancy we have the woman producing a lot of hormones, and some of these hormones may affect the way the cell responds to the insulin, because the insulin receptors that are found on that cell do not allow the insulin to bind onto them. Hence, the cell is not able to take up the insulin, leading to what? High glucose levels. The last type of diabetes is a drug-induced diabetes, where we see that the medication you take may lead to an increase in glucose levels in your blood, hence causing diabetes. In this case, I guess the medication is stopped so as to not have this drug-induced diabetes. Now that you have a general understanding of what diabetes is and its different types, it is time to introduce to you my guest for the week. She's here to talk about her diabetes experience and just to share some knowledge with us.
Hi, my name is Ayan, and I am a soft life chaser, freelance content creator, and creative consultant in that order.
How long have you had diabetes?
I was diagnosed with diabetes in 2010, so that would make it, 11 years now.
How did you feel when you first found out that you had diabetes?
When I first found out about it, I was 13 years old. So it was pretty scary because the only things I knew about diabetes were from my paternal grandparents. So all I knew was what I'd seen on TV and with them, which is no sugar. So I was really scared that my life was going to change. At that time, I was obsessed with Fanta Blackcurrant and I couldn't imagine a life without it.
Were you knowledgeable about diabetes before, or did you start learning about it once you were diagnosed with the disease?
I was diagnosed pretty young, 13, so I knew pretty much only no sugar. That's all I knew about it. I didn't even know that my symptoms had anything to do with diabetes. So I knew pretty little, but once I found out, because I'm a serial researcher, I researched the hell out of this disease, trust me.
How did it affect or change your lifestyle?
For the first few years, pretty dramatically, because I had to cut out sugar and fast carbohydrates, so no white bread, very little white rice. I took everything sugar-free or no sugar at all, so no normal sodas, Coke, Fanta, Sprite. Those ones I did not take. On top of that, that was my first time getting into fitness because I needed to lose weight to be able to help my body cope with the diabetes. But the biggest one for me, which I'm still struggling with right now, was medication. Going from not taking medication at all to taking medication 3 times a day, injecting yourself at least 3 times a day, sometimes 4, depending, having to log in your sugars 3 times a day before every meal, having to write down what you eat, be very, very conscious about your intake and of both food and insulin was the most, I think, dramatic and changed a lot about my lifestyle.
What have you learned about living with diabetes?
One, I've learned so much about food and how many carbohydrates are in a banana. Like me and my fitness pal are like this. We are inseparable. I've also learned that a lot can change in someone's health just by diet and exercise. When I got serious with my eating and my exercise, I dropped insulin and now I'm only on metformin. So clearly, if you are able to get a healthy lifestyle, it will help not only with diabetes but with a lot of diseases as well. I also learned it's not as scary as I first thought it was. It is limiting, yes, but not fully. If you are able to master yourself and master the situations you're in, you'll find it extremely bearable, but it does take time.
So I'm guessing it's not easy to live with this disease and to deal with it every day. So what do you do to stay positive when things get tough?
It's very difficult to stay positive during tough times because sometimes you feel alone and you feel as if it's a bit unbearable and you don't want to keep doing this. I have other health issues that affect my diabetes, so when those are bad, my diabetes control is even bad as well. So the juggling all those things is difficult, but what I do to stay positive is I remind myself of the things I want to do and the things I've always wanted to experience, and to know that I need to be here and I need to be healthy to do those things, to be with my friends and my family and to experience new things. And that's what keeps me going when I do get to rock bottom, because it does happen. You just have to remind yourself that there are so many things you want to do and you can do, and you need to be healthy to do them.
What advice would you give to other diabetics and to the general public about the disease?
The advice I'll give other diabetics is, one, get a support group. They're very easy to find. You can just type in Diabetes Kenya in Facebook and you will find scores of groups. It really helps when you talk to other people because you realize that something that seems so insurmountable really isn't that bad, and that there are people there who are willing to help you and support you. It's good to have that support system of other people going through what you're going through. And also to not see it as an end when you're diagnosed. Don't see it as an end to how you've been living, what you've been eating. See it as an opportunity to find out new things, discover new tastes, discover a new lifestyle, instead of just seeing it as an end. To the general public, I would advise them to learn at least the basics about diabetes, because it will help you know if you are more susceptible to the disease. There are certain risk factors like your genetics, other diseases, your weight, your age. So knowing about it will let you be more aware, so that even if you do get symptoms, you can identify what could be the problem, because a lot of people are pre-diabetic and they are primed to be able to change their lifestyle so that they do not reach the point where it's full-blown diabetes, but because they do not know this, and they continue living that certain way or doing certain things, they do get to that point. Other than that, it's also to be a bit more open-minded. There are a lot of weird connotations people have about with diabetes. There are a lot of factors that cause it other than just simple weight gain and you ate a lot of sugar. It's more complex than that. So to just be a bit more open-minded about it and support people with diabetes, and also trust that they do know about their disease and how to treat it. So like if you see a diabetic person out there just one day having a cake, they don't have it every day. They're just there to enjoy a birthday party. It's not that serious. You don't need to run across the room and slap it out of their hand. Okay,
What other general life lessons do you have in relation to just life in general and how to go about it?
being diagnosed with diabetes so young has also taught me a lot of lessons that I've carried on to my other parts of life. One of them is that it is what it is. It's, if you've been given something, if you have a mountain you have to climb, across you have to bear, you can bear it. There is a way. You will find a way to be able to live with what you have. The one thing about humans is we are so adaptable. It's a problem today, tomorrow, a month from now, it's now part of your life. It is not the end. If you have something happen to you, either health wise or even in your personal life, it's not the end. It seems like the end then. And I know everyone says this, but it feels like the end then, but it really isn't. You just have to remember that Earth is hard, but you are tougher.
You have heard the wonderful story from Ayan about her diabetic experience. I hope this has made you more knowledgeable about diabetes and has tweaked your curiosity to make you go and research more and learn more about it. And yeah, that's it for this week, and see you next week. Bye.